What do you think about bariatric surgery? Do you think it's the easy way out for somebody who's wanting to lose the weight? Or do you think it's more complicated than that? As a nutritionist, what did I used to think about a bariatric surgery as an option for someone who's wanting to lose the weight and get healthier and happier? I'm Bilga McPhee, a bariatric nutritionist, and I am bringing you this video to tell you a little bit about how I got into bariatric nutrition and what I think about it now versus what I used to think.
Outside the bariatric space, as a nutritionist, I look after patients and I guide them and coach them for them to actually adapt to diet and lifestyle changes to better their metabolic health conditions. Those metabolic health conditions are things like insulin resistance, type 2 diabetes, high blood pressure, fatty liver disease, or conditions like polycystic ovary syndrome, low moods or depression, and also things like chronic fatigue syndrome. So as you can imagine, operating as a nutritionist and guiding people through all these changes requires a lot of effort, requires a lot of discipline, commitment, knowledge, and a lot of communication. It is a lot of work and it is a lot of effort. And a lot of people can think bariatric surgery is the easy way out. So people might be quick to judge. So you couldn't commit, you couldn't, find the discipline in you or the educational tools to do the hard yard, and you went with the money, for instance, if they went private. So you just gave the money and you got the surgery and that's it, you got your solution. So people can be quite easy to judge. Although not coming from a judgy perspective, I did not know much about the bariatric surgery space. What my understanding was that it could be beneficial for extreme cases where people are really in a very dire situation that they can't even get out of bed. And I didn't know much more about how bariatric surgery can be applied to cases not that extreme. So when I came across an ad looking for a bariatric nutritionist, I thought to myself, why would you need a bariatric nutritionist for a patient who's just had the surgery? Because isn't it about getting the surgery done? And that way your stomach does the job by getting smaller in size, and that way you're eating less and losing the weight. So my understanding was limited to that. But when I read the text of the ad as well, that there's a team of experts looking after bariatric patients, I thought, team of experts, what does that include? So I was hooked, I was intrigued. I thought, okay, so there's more to the bariatric surgery. I found out when I looked into the job that there's a team of experts consisting of the surgeon themselves, a nurse, psychologist, counselor, physio, a coordinator, and the dietitian/nutritionist themselves. So they were looking for the nutritionist to come and join the team so that the nutritionist can help people before and after the surgery. So before the surgery, the patients actually come and meet with the team of experts, an hour and a half with each of the experts. And that way they get assessed for their suitability by the team. And also it gives the patient the chance to actually assess if this is for them. So again, it's not an easy way out. It's not very simple. So there's a lot of steps to this. And there's a lot of, digging deep into someone's life and someone's, it's actually so much more involved than just booking in a surgery and getting it done. So the second part of the job involves looking after these patients for 2 years after the surgery. Basically, they come in and they see the psychologist, the nurse, the surgeon themselves, and the nutritionist for ongoing support, knowledge, education, and support. So it is very, very involved. I did not know that. So that changed my mind. I thought, okay, so it's not just a matter of getting the surgery done and getting healthier. What I learned about bariatric nutrition, bariatric surgery after I started as a nutritionist at the clinic is the fact that we are very, very easy and very quick to judge people, and weight or metabolic conditions, metabolic diseases, it's not a one-way street. It's not just about people's diets and lifestyles. It is not a choice, it's not an option for some people. So there's socioeconomic reasons, as well as there are psychological reasons, there are neurodiversity reasons, that there can be many other reasons as well for someone not to be able to actually stop the way they are operating from a nutritional and lifestyle perspective. So all those things, and on a patient-to-patient basis, my horizons just opened, and my understanding and my knowledge base and my education just got bigger and bigger and bigger, and I found myself to be in love with being a bariatric nutritionist. I absolutely love my job. These are people who are actually not doing it the easy way out. They are changing their physiology forever. And the thing is, changing your physiology, going through the surgery, and then if you're still not able to actually change your diet and your lifestyle, then you're back at the starting point. So it is actually, it carries a huge risk. If you were to regain the weight, if you were to not be able to actually follow the guidelines, you might go back to the start. So for that reason, it's not the easy way out, and no one makes this decision lightly. It is a life-changing operation, but it comes with a lot of complications, risks, and you need to think about a lot of factors along the way. So it's not the easy way out at all. One might ask though, if the weight or the metabolic diseases are because of these other underlying conditions like the psychology or neurodiversity or trauma. So you might ask, so how is the surgery going to actually change that? So that's the sweet point. What the surgery does for the patient is that for the 8 months, 12 months after the surgery, which we call the honeymoon period, the surgery kind of takes care of the weight loss, and with the weight loss, you're actually getting better with the metabolic health side of things. So that's when somebody who's gone through the surgery should be able to actually recreate their diet and lifestyle and firmly actually put it into their life, so that once they reach the 12-month point, that they can enjoy the benefits of that lifestyle. The surgery gives them a pause button, so that they, the stomach itself stops the person from eating the foods that they were addicted to, perhaps the food lookalike items. I'm going to call these ultra processed foods. So it gives them that stop, so that they don't overeat or they don't get hooked. But in that 8 to 12 months time, working with the psychologist, working with the nutritionist, getting the regular checkups is the most important thing. And if you can do it for 2 years, that's even better. So yes, it's not the easy way out. It's just a pause button for a patient to reconsider their options and recreate themselves and recreate their lives from scratch in the first 8 to 12 months. And then they have to stick to the guidelines, like to be able to enjoy the benefits of the surgery for the rest of their lives. So that's how I changed my mind as a nutritionist about bariatric surgery as an option for people.